Welcome to my channel. Today I'm going to start reading from the Cmpa website regarding the good practice topics as well as the e-learning. I'll be doing step by step and I will try my best to cover as much as possible, and while I'm reading I will try to explain few of the things which I felt very comfortable while reading this, as well as if I find a questions which comes in my mind I can definitely give an example. On my exam point of view, I would say definitely this website really helped me. I have read the Toronto notes regarding the ethics, but I would say most of the questions are just come in a based of scenario, and you are not able to tell that which answer can be the best fit. So these good practice will really help you to tackle and tailor the questions in a way that you get the correct answer. If you haven't watched my previous video regarding the resources for QE1, you can go and check it out, and you can see how I explain what are the things you can do in the Cmpa website, but as well as how can you take the advantage of this search box that will really help you to find out how to get the correct answer. So without wasting time, I'm going to start. One of the most important thing is good practice. As we all know, good practice is very important topic. So if you go in the educational and events, you will be finding the good practice here and the e-learning here. I'm going to start with the good practice. There are many topics if you come down in which you will find some of the subheadings regarding the good practice. So if I open all of them, I can go with the overview and then I'll jump into the first topic. So let's talk about professionalism and ethics. So in that you will find a topic of professionalism, number 2 boundaries, number 3 cultural safety, number 4 privacy and confidentiality. If we talk about physician patients, usually it's a decision making, it's a relationship and everything. So they are talking about clinical decision making, patient centered communication, informed consent, informed discharge, documentation and record keeping, test results, follow up, disclosure of patient safety incidents, medical letters, forms, and reports. If we talk about the physician team, that means we are talking about team members, so it will be more about communication with the team, collaborative care, situational awareness, psychological safeties, dealing with the conflicts, and delegations and supervisions of trainees, transitions, and care. And healthcare system, which is about quality improvement and patient safety. If I'm going on the MCC objectives, which is very important part of the of our QE1. So if I write here quality, you will find quality improvement and patient safety as an objective. So it's a very good uh, in objectives in this one, which they are looking to understand about this one. So if I'm going back to that one, you'll find quality improvement, patient safety is here. So this is very important and it directly reflects the objectives of MCC. Human factors, that means errors or anything can happen, missed error, or we can say near miss or something, these kinds of things. Just culture, medication safety, wait times when resources are limited. Medical legal matters, usually duty to report and duty to care are the important topic. So I will try my best to cover all of these topics in different videos. You can go back and forth to listen these and try to understand and make your own scenarios in your mind. So without wasting any time, I'm going to start the professionalism, which is our first topic from here. And the professionalism is coming with this way. It's an introduction and you will get the four different kinds of uh, guidance which we can talk. If I expand it, it's kind of a little bit of brief overview of everything, and one by one I'm going to finish that part. Okay, so professionalism, upholding the values of a profession. As we are a professional person, so we have to make sure that we are taking all the values accountability in that profession. Professionalism is at the core of medical practice and forms the basis of medicine contract with society. Patients need to know their doctor will uphold the values of the profession. They want clinically competent physicians who are also compassionate, altruistic, trustworthy. Medical professionalism is the translation of values of a profession into daily actions. So, as we all know, whatever we do, our profession is reflected on our actions. So, that's we call it as a value of the profession. Attributes of professionalism includes what? Number one, professional competencies and continuing professional development and medical education. We try to educate every day from the new guidelines, from the new resources. Honesty, we always have to be honest with the patients and with our colleagues. Number three is the protecting confidentiality and the privacy. It is not just about the patients, it's about the record of the patients and what the patient want. But respecting that part of the patient is very important and crucial in our profession. Maintaining appropriate professional distance in relationship and respecting boundaries. As we know, we cannot make the relationship with the patients, and if we are having a good relationship with our friends and families, but we don't do a favor when we are talking about our professionalism. So these kind of boundaries as well as distance relationship. Improving quality of care, that's our main goal. That's always we look after, that we have to provide a good quality of care to any patients who comes under care. Accepting professionalism, responsibility, and accountabilities. Four key elements support medical professionalism and quality of care. What are the four key elements which can support when you are trying to say yourself as a professionalism or providing a good quality? Number one, awareness of adherence to the standard of care. Whatever the standard of care should be provided in that situation, we are aware of it and we are adherent to that. Responsiveness to the patient's individual clinical and emotional needs. At the same time, as we know that we are not just looking after the clinical sign and symptoms of the patients, but we are also looking for the emotional part of the symptoms. So emotional part of the patient, so that's one of the things we have to look after when we are being in a professionalism. Engagement to working in partnership with patients, colleagues, and administrators. Our engagements as a team member, as a relationship with the patient, should always be in a respectful manner, acting with an integrity and participating in the process of professionally lead regulations, including holding each other's accountable for our actions. It is important to develop, monitor, and reinforce good professional practice early in the training, because the day we start practicing, if we don't put these things in our practice, it will be our habit not to have in the future. So that's why they are saying you should be monitor and develop those things in the early training, so you have a habit of doing those stuff. Studies have shown that the lack of professionalism on the part of the medical trainee can be a predictive of future problems with medical regulated authorities. So that's the same way we are saying that if you try today, it will be your habit tomorrow. If you try good things today, your habit will be good in future. But if you don't try the professionalism today, you might not have the habit to practice during your future practices. Cultivating professionalism, what we call in learner, is an important aspect of any medical teacher work. That means, as a student, as a learner, when we are trying to learn more about professionalism, it is the job of the teacher to make sure that they teach us in the important aspect of the professionalism. Preceptors can play an important role in the development of professionalism by modeling professional behaviors to enable the development of appropriate skills and attitude with both patients and colleague. That's what the most important things comes. We don't just look after the clinical part, but we have to look after what our attitude says, because the way we treat, the way we provide the standard of care also depends on our own verbal and non-verbal communication part. So that's the important thing we have to make sure we are developing during the professionalism. In addition, preceptors play a fundamental role in promoting professionalism by identifying a trainee concerning behavior at the outset and enacting targeted efforts to help trainee address those issues. The complexity of assessing and remediating professionalism issues for trainee remains a challenging area that offers an opportunity for faculty development and practice improvement. So what they are saying is that, as we know that the preceptor play a very important role for a trainee, for a person to identify that where the professionalism is lacking, where the professionalism at the good part, so they can try to improvise and encourage, especially if talk about the behavior. Targeted efforts, they should be putting some efforts to address the issue. If I don't know anything and I'm working under supervision of a physician, if he don't give me a feedback, I will never be able to improvise myself. So that's the most important thing. The feedback from the supervisor will really help us not to just be on the knowledge side, but as well as on the professionalism side. The complexity of assessing, definitely it's not quantity 1 2 3 4 5 checklist. It's kind of a very complex way how they can assess the professionalism, and remains a challenging. That's why sometimes somewhere it's a lacking part. So offer an opportunity for faculty development and practice improvements. Now I'm going to start the guidance, which they are four, and I'm going to start one by one. And there are few things which you see in the blue letters. Basically, these are all the links. If you try to open it, these are all the different good practices topics. So if you don't take it now, that's fine, because next time when you are doing other good practice, you might be completing the informed consent, informed discharge, or other things. So these are all the basically kind of a something which have their own big topic. Okay. Professionalism is in physician patient relationship. This is our most important job. Definitely colleague is, administrative is, but this is our primary job. The relationship with the patient should be coming in the professionalism. The patient's physician relationship is at the heart of the medicine. The central role of trust in the physician patient physician relationship creates a fiduciary relationships. This means that physicians have an obligation to their patients to act with the utmost good faith and never allow their personal interest to conflict with their professional boundaries. As we all know, we have to be very honest with our patients. Whatever looks to us, we have to let them know, and we never put our own conflicts during providing the care to the patient. The hallmark of fiduciary relationship is trust. The patients trusting that the physician, who are the more power due to their expertise, clinical knowledge, and skills, will only act in the best interest and for the good for the patient. We always look after one thing: we have to act in the best interest of the patient. We don't act in the best interest of ourselves. Whenever we are talking to patient, whenever we are dealing with a relationship which is a therapeutic relationship, we always put the patient as their top, as our top priority, as well as we call it as a best interest in patient, best interest for patient. We don't talk about ourselves. That is called the fiduciary duty, because it is always a trustworthy relationship. Physicians seek to maintain their patients' trust by embodying the following values. Number one, compassion. Number two, altruism. Number three, honesty. Number four, integrity. Number five, prudence. Compassion is seeking to address their patients' emotional and clinical needs. Altruism means placing the patient. Altruism means placing the patient's interest above their own, even when it is difficult. Honesty, being trustful about all aspects of the care, including when obtaining informed consent, providing informed discharge, disclosing patient safety incident. So if we talk about a patient who is coming to us and we say, oh, you have some kind of a COPD, you have a mild COPD, that is the thing which is, you will say honestly. You don't have to lie on that thing, or you don't have to hide any of those information. But the most important thing on the honesty part comes when you are trying to get that concern from the patient, when you are trying to provide a discharge summary to the patient, especially when you are trying to disclosing any kind of safety incident. Why? Because when there is a near miss or there is any kind of harm happen to the patient, we always have to tell in a very honest way, and we don't try to manipulate things. We do not have the we do not have to change something. We do not have to try to make some changes and let the patient know so the patient will not be angry. No, whatever is happened, whatever had happened, the event has to be told to the patient in the same way. If it is your mistake, you can say that it was our mistake. If it is not our mistake, you cannot. That's another story. We will also discuss about it, where you have to accept that was your fault, where you don't have to. That's also one of the most important thing which I have learned from Cmpa. But at this point of time, whenever you are providing the information to the patient regarding the safety with the incident which had happened with the patient, you have to be very honest. Integrity, practicing with the high moral and ethical standard, holding themselves accountable. Prudence means considering all relevant knowledge and circumstances that informed clinical decision making while respecting each patient's goal and values. Okay, so these are all the things we have to look after, and we have to make sure that we are trying to make it whenever we are providing the professionalism in our own profession. Okay, to preserve patients' trust, To preserve patients' trust, protect the privacy and confidentiality of the patient's personal health information, sharing only enough information to benefit the patients with those within the circle of care. If we talk about how can we build the trust or how can we maintain the trust of the patient, so number one, privacy and confidentiality. Number two, you only provide those informations that is coming in the circle of care. Okay, obtaining patients express concern to share the informations with those outside the circle of care. Avoid any personal or public or virtual conversations that could reasonably be seen as revealing confidentiality or identifying information, or as being disrespectful to the patients, their families, or caregiver. So if I'm going to give you a brief overview of these three. Number one, when you say that you are trying to build the trust and maintain the trust with the patient, you need to make sure you are taking sure that your privacy and confidentiality is the top priority in that trust. Number two is when you are trying to get anything from the patients, you make sure you take an express concern, especially when you are providing the information outside the circle of care. Let's take third party. That means we are going to give the information to the insurance company. Even though patient told the doctor, this is my insurance company papers, can you please fill it out for me, you have to still take a written express concern from the patient. You will not provide anything to that insurance company until patient sign the concern. Number three thing is, even most of the insurance company do have the signature that the patient has given the concern that doctor can provide the information, or the doctor can provide the blah 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 information to the insurance company. Avoid any personal, public, or virtual conversation. Don't try to be respectful. Try to when you are doing conversation, try to throw the information of the patients or any kind of identifying factors: patient's age, patient's date of birth, patient's name, patient's last name, patient's address, patient some kind of disability. Anything you don't have to tell in the conversations, which is more publicly, or maybe sometimes you're talking to someone as a personal, because it gives a very disrespectful manner. So these are all the things that helps us to maintain the relationship by a trust that is being maintained during the physician and patient relationship. To show the respect for the patient's cultural diversity and to provide the cultural competent care. As we all know that Canada is a multicultural country, so we have to make sure we are not ignoring, or we are not trying to influence by the cultural differences. We have to make sure we are respecting the cultural diversity. Patient is coming from anywhere part of the world, that does not matter, but if it's in Canada, he or she is Canadian, we have to deal the patient in a same way, but we definitely have to respect their cultural part also. If we don't know, we can ask, but if we know, that we make sure that we are not trying to do something that can oppose their culture. So that's why we call it cultural competent care. So that means you are trying to understand the cultural part of the patient, so you can provide a competent care to the patient and patients can be satisfied in that way. Treat the patients with dignity and respect. Every patient, either patient is coming from one race, patient is coming from the other race, patient is coming from one province, or patient is coming from other province, we always have to respect the patient. Do not discriminate against anyone on the basis of age, disability, gender identity or expression, genetic characteristics, language, material or family status, medical condition, national or ethnic origin, political affiliations, race, religious, sex, sexual orientation, or socioeconomics. So these are all the few parts where you can talk about how the cultural difference is, but there are many things in which we can be discriminated at some point of time. It is intentional or unintentional, but we have to make sure we are consciously trying our best to make sure that we are trying to providing a care that is culturally competent care, or we can say cultural safety care. Okay, now to communicate empathetically. To communicate empathetically, communication is not just the part of physician patient, but is also the part of teamwork also. But here, as we are talking about physician patient relationship, so I'm going to talk about the communication between a physician and a patient, or maybe their family members. Seek patients input. Always ask from the patients, is there anything they don't understand, is there any questions from them, if there anything we are missing. Respect patient's decision. Definitely we have a shared decision making. Whatever they say, we respect them and we tell them that we respect your decision, but we are providing you the enough information so you can take a appropriate decision for yourself. confirm patient's understanding. We always ask a teach back. We call a teach back means whatever we told to the patient, is the patient understanding? If they understand, can they teach us back what they understand? So that's a very good way of communication, because it helps us in the patients who have the language barrier, that do they understand, or we are just throwing a multiple kinds of information and patient go home and they don't remember anything. Number two things, it helps us to understand where the gaps are. If I told patients, okay, you can eat this, but you cannot eat this, so patient remember only the list which he or she can eat, but he doesn't remember which things he cannot eat. So then I will say, okay, you have the gap here, so I can address that thing again. So this is very important when you are confirming the understanding of the patient. To act in patients' and society's best interest, focus on the meeting patients' needs in our decision making, strive to meet reasonable accommodation request, provide appropriate assistance to any person who needs emergency medical care, effectively refer patients to another source of care for care if the physician's personal moral beliefs will conflict with the patient's needs, refer to your medical regulated authorities policies to guide the process of terminating the physician patient relationship when other options are not acceptable. So now we are not just talking about the patients, we are basically trying to talk about the whole society or the whole community where we are working, where the patients are coming. So let's take away first. Number one thing is, if a patient comes to your clinic, we have to try to make a decision according to their needs. That's we call a patient centered approach. We don't try to say, oh, you have sore throat, you have to take the antibiotics, but patient doesn't want to take antibiotics. What are the alternate options we can provide? So we are basically trying to meet their needs, but we are not trying to throw the information which we want to. We want a shared decision making. Number two, strive to meet the reasonable accommodation request. Sometimes patients come, oh, I want this, I want that, and if you don't feel comfortable to be doing that, you can say. But at the same time, if you feel okay, it's reasonable, then you can take the request and you can tell the patient, okay, I'm going to do that. Or you may negotiate on the one sentences and you can say, okay, let's talk about this now and we will see next time what's happening. So that's the one way of reasonably accounting. You cannot say, oh, I cannot do that, that's not the best way I can do, that's not going to be happen, until unless it is something which is unreasonable. You do not try to refuse in a manner that patients feel like they are not being heard. So it's better that we try to come into negotiation, or we can try to make a reasonable accommodations when it is appropriate. Providing, because at the same time we just have to protect our license and our practice too. Provide appropriate assistance to any persons who needs emergency medical care. That's the one thing. If you are going to one province to another and you don't have the health card of another province, or you are coming as an immigrant from somewhere and you don't have the centralized healthcare system card or something, but you are in emergency situation, so as a physician, it's my job that I will provide my best assistance, best care to you until we figure out that you are safe to leave the facility, or you are safe to be transferred to some other facility where they can meet up there all the other things. But if it's an emergency, I would not deny that if you don't have an insurance, I cannot treat you in emergency. Even though you don't have insurance, you coming from different province, you coming from different part of the world, whatsoever happens, emergency care has to be provided whatsoever happen. Effectively refers patients to another source for care if the patient's personal moral beliefs will conflict with the patient's needs. As we all know, abortion is a very good example, but nowadays cannabis, which we call the medical cannabis usage, is also second most important thing. Or you talk about the opioid use. Nowadays most of the doctors are providing opioids, but if you feel like, okay, opioid is one thing you don't want to give for any reason, is something moral or something happening, or let's take a cannabis as a very good example. I know everybody knows about the abortion part, but cannabis is the second thing, which as a medical cannabis most of the doctors provide it in their practice, but few of them do not practice. So if they don't practice it, they will say, okay, I will send you to my colleague, she or he is providing the medical cannabis counseling as well as the prescription, so you can get it from them. And but all the other things we can do because I'm your family physician. So that's the one thing which we know, that if we cannot provide it, but we know there's an option to provide it, we can just transfer it, and we can effectively tell the patients that why we are doing it and what are the reason behind it and what are the things you can still do for the patient. Referring to the medical regulated authorities to authority policy to guide the process of termination. sometimes we do come up with the process of terminating the relationship. The number one thing is, if the patient is not getting benefit from the relationship, that's the one thing. Number two thing is, if you feel patient is being abusive, patient is being physically violent to the staff members or to you, and you don't want to take the relationship anymore, then you can send the patient or send the letter to the medical college, and then they will decide what they can do. But definitely you cannot terminate abruptly. You have to tell, or you have to give a time frame to the patient that, okay, I'm not going to see you after this month. You have to find a new physician for yourself because of the reason of this XYZ. And this has to be involved by the medical regulated authorities. This cannot be done directly. So this is one of the things which is the society best interest. That means the patient who is going outside your care, he's become a part of the society. Now you are doing it because the benefit is not going to that patient, so you can take someone else on that basis. So that's why. But that patient uh, has to be going in someone's care. He needs care from the physician, from any kind of person who can give him medications or something he needs. So at least he has an option to go somewhere else, and he can figure out where he or she can go. So that's the one thing which we have to be doing in the best interest of the patients and the society, to maintain the appropriate professional distance in the physician and patient relationship. Avoid potential perceived or real conflict of interest. We always make sure that our boundaries, our relationship with the patient, make be an appropriate path. We can say it's a kind of a box which is very appropriate. You don't try to make something which can makes the box awkward in a moment. So that means don't try to use something that is causing a conflict of interest. Do not enter into the romantic relationship with the patients. This we all know. Usually, if it's not a psychiatric or mental health issue patient, you cannot make a relationship with the patients during your practice, even after 1 year of termination of practice. Like, let's suppose if someone is in romantic relationship today, they has to be out of the care, out of the physician patient therapeutic relationship for at least 1 year before they come up with the relationship of a romance or something. So that's the one thing. But if someone is mental health issues are going on, like let's suppose psychiatrist, they cannot do it even though they terminate the relationship with the patient. So that's the one thing. Like, we have to make sure we do not involve ourselves with the patient. That can be a romantic relationship, or maybe onwards you go and marry or something. So this is one of the things we always do it, because that's come in our professional boundaries, or even former patient, depending on the circumstances. So circumstances, most importantly, which I have learned, is mental health issues, which is not coming into the consideration at any point of time regarding romantic relationship. Limit treatments to immediate family members and those with whom the physician has a similarly close relationship to minors or emergency interventions, or only when another physician is not readily available. The best important part of this one is, if you have a family member who doesn't need an urgent care, do not try to give anything to the patient, to your family member. Just say that, go to your family physician. But if it's an emergency, there's nobody around, the physician is not around, there's a minor things which is happening, and you feel like, okay, fine, that's how I can do. But yes, but it's very limited. So from exam point of view, I think the best thing we can remember is, don't provide care to your family members until unless they're not dying. You do not have to provide anything. Just tell your family member to go to your physician. Even you do not try to treat yourself too at some point of time. So that's although the same thing. So for exam point of view, I believe we can remember in a way that, okay, we do not provide any type of care to our family members, because it's not appropriate. We become biased at some point of time, and we may become emotionally weak at some point of time. So that's why that is very important in our ethical portion. Do not prescribe psychotropic medications to family and friends, because psychotropic means, if you talk about psychiatry medications or something, that's kind of a things needs monitoring. That's kind of a things needs follow-ups. So you cannot make a follow-up if it's an emergency situation. Yes, once it happens and you need to provide maybe something which the patient need, and the family doctor is not available for next 5 days, that's okay. But if you talk about psychiatric medications, that should not be prescribed. So that's the boundaries where we become as a physician, but I cannot, or you cannot provide it to your partner, you cannot provide the care to your kids, or you cannot provide the care to your family members because of the professional boundaries. So this was the first topic of the physician patient relationship. I hope you guys like it. I am going to start other three topics in the different video. Just stay with me. At this point of time, if you feel this reading was helpful to you, it might increase some of your knowledge, it might increase some of your concepts. So please like, share, and subscribe to my channel, and I would be happy to help you every possible way, which was the one thing which I have tried for my exam. Thank you so much, and have a great day.